Doctors really bring their emotional baggage to the exam room, don't they?
They very much do, and it cuts both ways. One of my misdiagnoses was a woman who I found irritating. I was a resident, I was young, I was impatient.
You described her voice like nails on a chalkboard.
Nails on a chalkboard. And we all have people that irritate us. She was complaining of discomfort under the center of her chest. And I basically closed my mind. I gave her antacids and stopped thinking. And it turned out that she had a tear in the aorta, the major vessel that leaves the heart.
How does liking or disliking a patient affect the doctor's interaction with that individual?
Well, it's been studied through researchers at Johns Hopkins, and they found that if the doctor doesn't like you, he or she closes their mind off very quickly, and you do not get good care. It's a setup for misdiagnosis.
Why is that? I mean, what is it about an unlikable patient that makes a doctor react like that?
Well, one of the greatest challenges are people who are not communicative, who don't give a good history, and also people who have psychological problems. This is really difficult. People who complain or have many symptoms, and it's hard to pinpoint what's wrong. But people who are hypochondriacal, who worry that they always have illness, or people who are mentally ill, many doctors react negatively to people like this. But the truth is that hypochondriacs can get sick. And people who are mentally ill can have a physical illness. So you have to keep your mind open.
Tell me how liking a patient can actually work against that patient.
I tell a story in the book of one of the physicians I admire the most, who was very, very taken with an older Jewish man who was, funny and warm and so on, who was complaining of a lot of indigestion and stomachache. He gave him antacids. It didn't get better. And it turned out, after a number of months, that this man had a cancer in the stomach. And the doctor realized that he had not sent the patient, this older man, for an uncomfortable procedure. He hadn't sent him for an endoscopy. He didn't want something going down his throat and uncomfortable and the anesthesia, even though it was clearly needed, because he didn't want him to be uncomfortable. And he just flagellated himself, the doctor, for that error, that he cared too much and that interfered with what was clinically needed.
So sometimes if you have an emotional connection with a patient, a doctor can almost be too protective of that patient.
Exactly. And the doctor needs to go with his heart and care, but he also has to have his mind working at all times, and that mind has to be aware of the emotional temperature.
What can patients do, Dr. Groopman, to be better patients? How can they help the doctor make better decisions?
It's a partnership. And I think that a patient who knows how a doctor thinks can communicate better and help the doctor not make these thinking errors. There are a series of very, very simple and completely appropriate questions that a patient can ask.
Like,
the doctor says, I think you have this. I think you have indigestion, acid reflux. A patient can say, what else could it be? Especially if it's not getting better. Or, could two things be going on at the same time? Doctors tend to latch on to one diagnosis. Someone could have acid reflux and also heart disease. You don't want to just focus on the acid reflux. You can also ask, is there any test or x-ray or anything that's been found so far that contradicts your impression? Because we tend to anchor our minds on one diagnosis and almost subconsciously discount information that contradicts it.
Will a doctor, though, feel threatened if a patient even politely challenges his or her assessment?
I think a good doctor doesn't want to make mistakes. And it's hard, but on the other hand, You know, we're in an era now where people talk about empowerment of patients. And patients should be knowledgeable. And patients should feel comfortable asking those kinds of questions, because those are the questions that doctors ask each other behind closed doors.